What is type 1 diabetes? Who is at risk? What are the causes and symptoms?
Type 1 diabetes is a condition where the body stops producing insulin. This is because of an internal immune mediated destruction of the beta cells of the pancreas, which are responsible for secreting your body's insulin. So, because of this autoimmune reaction that occurs within the body, your own body cells destroy the cells within the body which are responsible for normally producing insulin. And insulin, as we know, is the hormone which is responsible for keeping the blood sugar within control. So, because of the fact that there is no insulin being produced as a result of this destruction of the beta cells in the body, a person develops type 1 diabetes. And if this condition has occurred, then the person will require lifelong insulin injection in order to get that supply of insulin that the body is supposed to be producing, which it now does not. It is difficult to predict who is at risk of type 1 diabetes. There are some antibodies that are present within the body. If these are present in a particular individual, then he stands at a higher risk than somebody who does not have these antibodies. Also, if the parents or the siblings of the patient are sufferers of from this disease, then then the risk of developing this disorder increases somewhat. So that is all that we know as of now regarding who is at risk. So the risk increases if there is somebody in your positive relations have the disorder, or if those antibodies that we know about are present within the body. The cause of type 1 diabetes is an autoimmune destruction of these cells within of these beta cells within the pancreas, which are responsible for producing the body's insulin. So this process is autoimmune, which is to say that the body misdirects its immunity against its own body tissues. This is why a person develops type 1 diabetes. The symptoms of the disorder can be catastrophic to start with. In many cases, the patient, usually a young child, lands up in the intensive care unit with what is known as diabetic ketoacidosis, in which the patient might be unconscious, might have been vomiting, or have had pain insulin for a relatively short duration. And this is a condition in which the blood sugars tend to be very high. There's associated acidosis within the body. There's associated ketosis within the body. And this is a life-threatening condition. The patient has to be administered insulin and managed appropriately. And once the patient is out of this diabetic ketoacidotic condition, then he will require lifelong insulin injections. So this is one of the presentations of type 1 diabetes. In some other cases, the patient might develop a very rapid onset of excessive thirst, excessive hunger, excessive urination, rapid weight loss within the course of a few weeks, and might be diagnosed with type 1 diabetes.